that.
Well, good night to the world and to all who are viewing us tonight. And once again, welcome to our World Changers Wednesday night forum, where we do several panel discussions and different sessions on various topics we have been doing over the past few weeks. And tonight we are in that very same mode, where we are going to continue on our Wednesday night panel discussions. And tonight we have a very interesting and a very, I'm sure you will be very much interested tonight in what we are going to be talking about. 2 weeks ago, we would have done a session on drug addiction, and we did that session with a few of our resident folks. And we spoke to you, we discussed stuff about drug addiction, what it meant, how some folks got involved, and we looked at it from the perspectives of folks from the prisons, folks from the St. Anne's Hospital, and we also looked at it from a local guy who was addicted as well. And that session proved to be very, very, very informative and very dynamic as well. Tonight we are going to do something of a part 2 that speaks to drug addiction as well, but from a different slant. We are going to be doing it directly from experience. You know, there is nothing as valid and there is nothing as real and as connecting as our story from experience. And tonight that is exactly what we have for us tonight to discuss. We have on set someone who's going to share their story, real life experience that they would have had with drug addiction, with the effects, the connections, and the various challenges that drug addiction can bring to a life. And we are going to get some really live information tonight, some stories, some experiences that will help you and your family and all who are listening to us tonight, whether you are involved in drugs directly or you are indirectly affected by drugs. You are going to benefit, we are all going to benefit tonight from tonight's discussion. So we have on our set tonight a gentleman by the name of Troy, what's his surname again? Jonquet. Okay, very interesting surname to pronounce. That's French?
Yes, sir.
That's a French surname, Jonquet. So Troy Jonquet, I've known this gentleman for all my life, and the surname never did connect with me though, Jonquet, but that's great. So we are going to talk to Brother Troy Jonquet tonight, and his story is one that is cannot be exhausted by any means in our one-hour session that we are going to conduct with us tonight. His story and his experience cannot be exhausted by no means. We are going to just touch on some of the experiences that he had and that he has experienced in his life. I'm not going to give you his story, I'm going to allow him to share with it, but I'm just going to guide us through as we ask questions and point to several areas in the life of this gentleman tonight. Let me just allow him to introduce himself basically and see where he's from, and we are going to go straight into the discussion tonight.
Good night, I am Pastor Troy Jonquet. I am originally from Kanki Village in Beach, and because I spent most of my life growing up in the Beach area, you know, and at present I live at 19 Cashew Gardens, Edinburgh Road, Castlefield, with my wife and children. Basically
that's just your immediate story at the moment. Great, excellent, thank you so much. So as you are hearing from the gentleman, he is now Pastor Troy Jonquet, and he is no way, if you look back at his life and when you hear his story tonight, you will realize that to move from where he was, where he started off, to become Pastor Troy with a family living comfortably in Chaguanas, the move from that start to this present could blow your mind by the amount of things that you have gone through. I'm not sure how much of it we'll be able to share tonight, but we are going to see how far we can delve into the life of this gentleman for the benefit of all that are listening. So let's begin somewhere. Where do we begin? Let's begin somewhere close to the beginning. I'm going to ask you. You said you grew up in the village of Bish, Kanke Village Bish. For many who may be viewing, who may not know where that is, but we who are present here, we are very familiar with our community and what it involves. A very small, remote community somewhere in the middle of Trinidad that has been established over the years for a very negative name, but at present really it has not been that prominent in that regard anymore. But you have been brought up in this little community, and you said that that's where your story began.
This is where my story.
Give us a little brief start of how your story began in this community.
Thank you, first of all. It's an honor to be here tonight. I give God all the praise and glory for my life. I give Him thanks because I never thought when my journey started and when it began to escalate that I would ever survive, and that I would ever live, you know. But God is so merciful and so awesome in that I'm here tonight, and I trust that those who are listening will know that drugs, first of all, is just one of the symptoms of addiction. Addiction itself is governed by two components, which is obsession, a fixed thought or idea that takes you time and time back to a nature of behavior or a substance or a relationship or anything that becomes so obsessive that despite the negative results coming out of it, you cannot seem to detach yourself away. In spiritual language, we call it bondage, extreme bondage. And the other element is compulsion, that is the inability to stop what's having started. So once you initiate a process in this whole field of psychical addiction, drugs is just one of the things that people are addicted to.
Okay, great. But in particular to your story, your addiction, was it to one particular drug or a number of drugs, or was it to relationships, or was it to, what exactly was the nature of your addiction? How did that start?
My addiction basically was at first seeking to find a way to escape the level of poverty and brokenness that I grew up in. First of all, let me just share with you that I come from a home where myself and my brother and 4 other sisters, we were ostracized from our parents, meaning father and mother in our home. Okay. So basically we grew up with just our mother, and went through domestic violence and abandonment took place. We found ourselves in a little corner with just a mother. She was not an educated woman to say that she had a job that she could have sustained all of us. She was very good with her hands. She did servant work for people. Okay. So with no place to put 6 children, we ended up in different corners of Trinidad and Tobago. So myself, my brother, and my last sister, we ended up by a woman who is a polio victim, like my aunt. Right. She walked on her knees. People knew her in the village of East as Miss Joe, because she was a polio victim with no feet. She had an upright statue on her knees, and just below her knees there was an attachment of something resembling like the palm of her hand and her toes. We grew up with her because when my mother could no longer keep 6 children in one little room, because she used to wash and iron for some people in Scotland Street in town by a friend of hers by the name of Sylvester's. So in that little one room there was no way she could have kept 6 of us there. So my elder sisters, they branched off to stay by neighbors and good friends. And the influence of what they had to go through with no father at their side and no financial or moral support, because as we see when abuse and when brokenness takes place, when people are pulled away from a secure family unit, there is so much of chaos and confusion and pain in the minds of people that anything that could distract you positively away from that situation becomes your primary purpose at that time.
So you were saying that you were brought up in that kind of environment, detached from your parents as such, And of course, poverty would be one of the main factors there in terms of what would also lead to a form of need and dependency and so on. Yet we know, are you saying then that these are the factors that kind of like drove you to or led you to an escape through drugs or led you to some kind of connection with drugs?
Well, first of all, it was the inability to handle the pain of detachment away from a secure environment with mother and father.
Right.
And you having siblings now, and you're not sure what your tomorrow is going to be like.
Okay.
So, being thrust into this position, living in Beach with my aunt, we grew up in an Altapia house, maybe 15 by 15, around that size here. And she being a polio victim, living on government poor relief at the time we call it.
Yeah.
She said surviving $27 a month. That is what we knew. And it's not the poverty that started off my addiction, but the pain of being detached, the pain of not knowing exactly what to do with the fear and uncertainty
And the insecurity.
and insecurity that
from
suddenly came
access.
from a place of being secured, a place of, okay, mommy and daddy kind of thing, and then abuse, and then a total moving away from separation from that.
What age were you when that separation or that disjointed took place? What age were you then, about approximately?
There was always abuse in my family. There was always, so from what I was told, I spent from the age of 3 months to 5 years with this aunt in Bish.
Okay.
And when I knew my normal parents, my father and my mother, I spent from the age of 5 years to 8 years with them. So it's only 3 years I really ever had
Some
having parents. Yes.
Oh, so definitely, and those are
At the age of 8, the separation took place.
And you are speaking about some very, very, very impressionable years that you're talking about. We are most of the time, those are the areas where security needs and your very closeness and comfort, very, very important at that age. And could be very scared if you don't have those or you are detached from those in that age. Let me ask you, go a little deeper. So that was your environment. And we are not going to say whether this caused me to go into drugs, or this, we're not going to assume, we're not going to conclude that. But let me ask you, your environment was like this, and what was your first experience? What was your first, what was the first area of channel that caused you to be introduced to drugs or some kind of substance?
I'm going to make it very when especially a man-child does not have that blueprint of a father in his life, he goes about seeking some other figure that could represent father.
Absolutely.
Because he wants something to be connected to that would help him place one foot in front of the other as he goes through life. So when that is absent, there is a void. So there is also a longing and a need. So you go through looking for elder brothers or people to connect with.
A substitute to put inside there.
Yes. So they can never really substitute that. But in the pain and the little chaos that reigns in the eyes or in the life of an 8 or 9-year-old child where it was, my situation was not the cause, the poverty was not the cause. I'm just saying that because when you don't have enough to eat and drink, and
it could contribute.
It could, but basically it was something. It was an emotional need, a need that needed to be filled, a void that needed to be filled. So I went looking for some love and some attention and some peer groups to connect with that would make me feel safe. And some of the young men that I grew up with, began to experiment from a child, and also like. They would find a zoot, a cigarette that was outed by an adult, and they would say, let me pull another young man, this the excitement of trying to forget what's going on with your situation. That was another kind of positive distraction. The peer group, the excitement, the adventure, and from the time or like that thing called black sage bush. They said, guys used to say, somebody say if you're dry relief and you can take a puff, it feels good and all that kind of thing. Basically, it was from a standpoint of not feeling good.
Right.
So,
and not feeling good, and of course, the substitute that you would have gotten from connecting with your peers at the time, you would, of course, feel that sense of belonging, that sense of attention, and that sense of, not security so much, but apart from the fact that you would not have gotten that from your home and your father, in your peer group there, you would have had to kind of like depend on that for your sense of belonging and acceptance as well.
It was more like a form of stability being around my peers, because with the pain and with some of the violence that I experienced happening in home, today I really don't blame or put the blame on anyone because I realize that God in His wisdom sometimes allows destiny to unfold in such a way. So there's always, once His hand is in the midst of it, through His mercy or grace of covering, or just allowing things to take a certain way, there's always a different type of processing that He brings into it.
Okay. Great. So we have a kind of idea of your background and where you came from and what happened with regard to your family. Now, based on what we kind of know from your experience, you became dependent upon a substance at some point in your life. Can you share with us about what stage in your life, what age in your life you kind of realized or kind of identified that you were dependent on a substance, and what was that substance, and how did that dependency reach the stage where your life was almost destroyed?
Well, first of all, as I mentioned to you, it started at that age 8 and 9, with experimental use of the little henna tobacco.
Right.
And, like when you take a little puff, you're coughing because remember, the toxins from the smoke, it's something foreign into your body. But what happened is that when whatever little residue get into that place in the brain, and you feel that buzz like your head spinning and like you're on top of the world, and for a few seconds or for a few minutes, nothing else matters. It was a great form of escapism.
Okay, sure.
So, as I continued along life road and going through the little hardships that I presented, one of my escapes that I began to feel dependent was, the dependence was not on the drug first, it was upon the people who gave me the appreciation and the company that, yes. Right. And it's very important to note, because people believe it's always, about the drugs and the pushers. No, they got their stuff to do. But parents or guardians or whoever have a certain stuff to do also. And in the absence of that kind of guidance, the peer group becomes the void, the filling of that void for your parents.
Okay. And a whole lot of times, so you're identifying more that parents should kind of try to fill that void. If parents would be more mindful and more conscious of filling that void, then it's possible that we may see less young people finding the need to have it substituted by the company, and the company eventually leads to some negative or to some self-destructive habits.
I really want to empathize with parents, because when we look at the world, it's a social structure of how things happen. We look at the economic state of certain countries. We look at some of the privileges that some people have versus some that don't have. The parents that struggle through, especially in single parent situations, to really bring up children, it's very difficult,
yes.
And you can't wish them away, because every child has a destiny from God, but just the circumstances may be a little. So I'm saying that, but now that I know, I do not fail to tell my son, he is 14 right now, that's my youngest son, my youngest child, he's 14, and he's feeling uncomfortable, but I tell him, I say, Isaiah, my father, I love you. He said, yeah, God, I know. But it's something that seems so foreign in the ears of children, the word I love you, that no matter what social situation may face you, if there is a connection between you and your siblings, knowing that, listen, I voted for this child, and despite what relationship didn't work out, or what financial aid is not there. If I can only give enough attention, even when I have the time, through the spoken word, it could make a difference.
To sway them away from stronger influence that may be out there. Okay, great. So let's continue to see if we can delve into your situation again deeper. You said about age of 9 you got experimented with these zoots and these smaller that would be tobacco.
Tobacco.
Was there any movement forward, or let me call it graduation in quotation marks, from cigarette to something else to something? Was there any movement from tobacco to something?
Well, definitely. First of all, I must tell you that the emotional situations in everybody's lives causes you to press forward to look for that place where you would feel secure.
Yeah.
So after the initial taking out the puff of the zoot and then lighting all kind of brown paper and looking, you see, because example in a social in an environment plays an important role, and the people who you saw properly dressed with all the nice jewelry, nice cars and everything, puffing very gracefully on a cigarette or drinking a beer or maybe even a joint. And every time you call them or you reach out to them, they say, hey, small man, and they say, how you doing? They say, well, I'm David. And they say, how are you doing? And they tell you, just cool. Somewhere in your head, you know,
that is how it's supposed to be.
one day I want to be just like that man. He got everything and he just cool. I didn't understand how the just cool would come. But as the drug addiction progressed, addiction is a progressive thing.
Absolutely.
In that the tobacco and those things would just want to be productive distractions. But as you continue to experiment, social use becomes dependent outside of social environment. What I'm saying is, like, when you have social events, like a little bazaar, you used to have in New Orleans on the ground, or up in the savannah, you'll get a little bit of Charlie's wine, or you would get a little bit of, you'll get a little bit of nitrate, a wine called nitrate. But that was the deadly one. And as a young man or young woman already experiencing certain voids in your life, and you get a little sip of that, you laugh, you giggle, you have fun. All the time, there was no danger attached, because it went from one social event and you would live with the expectation to the other social event to use. But as addiction progresses and the dependence on that stuff to make you feel good comes outside of that social event, that is where the trouble begins, because experimental use and social use goes to another level of dependence.
Can you identify then in your experience when it moved from social use to the non-social use, where you had to have the substance out of the social or the
social event?
Can you identify a point in your life or stage where you had to?
When I was around 11, between the ages of 11 to 13, this is when my hormones was changed as a young man. My aunt or the neighbors around was not the most beautiful woman in my life anymore, because the testosterone level that started to play, now I can just explain this so people understand, begins to create certain other desires. It begins to make a young man seek or a young woman seek to do something that would enhance their self-esteem.
And also attract the opposite sex at that point, because they're now going to puberty.
Yes, to get some type of attention from. To get some attention from. And this is where poverty in your mindset plays a role with some people. Well, I mean, if you don't have enough to eat and drink, enough to wear, remember whatever you are physically would attract a mental or some kind of
that you want to create.
Thank you. And so I graduated in school when I began to go to high school. Well, first of all, you spoke about something earlier on. I would just touch on it. When I was growing up in the community of Bish, it was said to be the land of green gold. Right, and that people were blessed by it. But it was just a phase, because right now, you know, Bish has grown far out of that so many years now. But there was a time when it was an acceptable norm.
That's right.
Acceptable norm. Not among the people who held values closely, you know, because there are a lot of great minds and people came out of Bish who never entered it.
Certainly. You know, it was like that, because, you know, in society, the negative vibes or the negative images tend to always gain more attention and gain more popularity, kind of thing. So we know that with regard to that. But in your particular experience, how did that was that something that helped, that contributed to you being exposed to drugs earlier or something?
Well, I want to be very honest. When I started to look for my self-esteem, and started to look to see where my self-image, because remember, when you're not in a stable family, not enough to eat, not enough to drink in a community or in a social area where people know who you are tend to sometimes you are defined by the opinions of people.
Basically.
Your status sometimes has to define you.
Right.
So in order to be like, just try to rise above that and numb yourself away from that, marijuana became like a healing for me.
Okay.
At that time.
A healing, an emotional healing, or something that would kind of take you away from the status.
Thank you. It was a form of distraction, but it also, because of the nature of the drug, because I think tonight God wants me to share a little bit on some clinical aspects. But after I speak about myself, right?
Yeah.
Because God has allowed me to use, which was a real downfall in my life, to really be like a stabilizing factor for the lives of thousands of young men and women across the nation. So I graduated and I found that there was a great dependence in my life for marijuana.
That's about age, after 11?
Between the ages 11 to 13.
Okay.
Marijuana and periodically a little bit of alcohol. Right? Because alcohol, the nature of it being a central nervous system depressant, depresses your central nervous system away from the reality that you're into, and momentarily takes you out of that. So you could dance, you could laugh, you might say some things that you can't remember the next day.
So you're saying that alcohol does that?
It does that because
does marijuana do the same thing?
Marijuana, because it's a different drug, it's a central nervous system sedative, but it has become one of the most dangerous drugs in my study and my life known to mankind. Because marijuana is not only in the medical chart as a sedative, it is also based upon how your body metabolizes the drugs or what type of tolerance you have towards it. Because I have known men or young men to use marijuana totally triple and mad. Because it has psychoactive chemicals in it. Because marijuana is a central nervous system sedative, but it also has the effects of a central nervous system depressant, like alcohol. It also has a central nervous system, what we call hypersensitivity, or it's called a stimulant. Like, so the same effect cocaine will have on somebody.
So are you saying then that marijuana use can have either of the those four things you could cause
sedative,
reaction?
depressant, stimulant, or hallucinogenic. And
so depending on the person who's using it, they may have different effects.
Because
or is it that it does, or it responds with everybody? Is it like
well,
that?
let me just take one moment off. Marijuana, because of our body produces certain chemicals. From the base of your skull to your coccyx to the top of your buttocks, the adrenaline fluid that flows there has a great effect to do with when you use drugs. Because like when I was using in the early days marijuana and I became so dependent, it led me into a high level of super sensitivity to get into martial arts. So I performed some of the most serious type of stuff under that kind of head.
Okay.
So for me, it opened up
another door. For you.
For me, it also allowed me to be the super cool dude. So all my anxiety, my fears, my needs, my angers against my dad, my resentments against the world, maybe having dealt me this hand, they were all subdued to a certain extent. So I channel a lot of my energies into exercise and martial arts, but induced further by marijuana.
So you are saying that ironically or incidentally, although the drug is a dangerous drug, it didn't help you along your path or in your journey. At that particular point in your life, you were able to use the drug to how to put it? I would not say do some positive actions, but yet with a dependency, which really makes it not really positive.
Well, what I'm saying, I'm not giving this any positive hype, I'm saying to understand where I was and graduating from where I was with little cigarettes and things. As I grew older and my needs become different, the drug helped me to facilitate certain of those needs in an indirect manner and by channeling some of my energies, it opened up a door for me to exercise, and to exercise real hard. But
what are you thinking? I'm still trying to point to, do you think that you will be able to get into martial arts and get into the exercise and get into the weightlifting and the different skills that you were able to excel in, if you were not using the drug? Do you think that you would have been able to do so?
I would have been able to excel much more than that.
Oh.
Because what happens is that once you get into a place called slavery or bondage, that you can't seem to function without something, then you are always in a place of being a slave. Because slavery, even one of the men who was an advocate of the drug died as a result of the drug. Yet inside of, paradoxically, he gave a message. He said, emancipate yourself from mental slavery. None but ourselves can free our minds. So what he was saying is that long after the chains of slavery may have been broken, you, with the decisions and choices that you make,
can be
you could still find yourself in a piece of mental slavery. And I think the bondage spiritually and mentally go way beyond. It's much more tormenting, so much more suffering than actually being held in chains.
Yes, certainly, because the effects of mental or emotional attachment to drugs is far-reaching. Much not only you are affected, and that's what you're going to kind of like go into now, to how the drugs in your life, because you are now saying that you kind of like, I don't want to say graduated, but I want to say moved from the cigarette butts to connected with alcohol temporarily, and then you are now connected with marijuana. Did it go further than that in your life? Did you have, were you attached to any other drug, more drug in your life?
Much more further than that, because marijuana, when within the use.
Yeah. Go ahead.
Marijuana, during the time of that use, it connected me to a certain peer group of people. It gave me a certain level of acceptance by that peer group. But what happened is that I realized I could not be normal or do any things that I normally would do without it. So that was one of the far-reaching effects. Plus, it started to do something with the people who I was attached to. Because people in the relationships of your life, knowing that something you're doing is illegal and that there is a penalty attached to it, you begin to, first of all, isolate yourself. Somebody who becomes a user and become dependent upon that drug, and even graduate to other drugs, one thing they do, they go into isolation. People who can't receive them or accept what is happening with them or try to understand, they isolate themselves.
Well, naturally, it's a kind of societal, remember you are involving yourself in illegal stuff, you're involving yourself in stuff that is not acceptable in the norm of certain values and so on. So you definitely will be, folks will naturally pull away from you, and you will naturally be kind of, isolated from. Did that happen in your experience? How were you isolated, and from where were you isolated in your experience in using?
First of all, there is a certain level of self-consciousness that comes onto the person who uses the drug. From the time somebody who is attached to you in relationships, like your mother, your sister, your brother, or even neighbors or people who had held you in high esteem based upon some of the personality traits. They begin to look at you now with a different look. And that causes you now from being, and that causes them from being empathetic, caring and loving for you and understanding your situation. It goes across an opposite to becoming apathetic. They become antisocial to you.
Could happen, yes.
You know?
Could happen in a number of cases.
Yes. So when this happens, the person who is the user, you isolate yourself further and become very angry. You become a very angry and resentful individual because you believe that somehow, if they can't understand why they just don't accept you as you are. But remember, they're dealing with a value system that you have walked out, or you have been pushed, or even
that you are rebelling against.
Yes. So so you definitely come at odds with the people who normally would care about you.
How was that in your experience? Because you would have been now, who were the folks that you would have left, and where would you have gone in your isolation or in your movement away from that immediate first family kind of thing? You would have moved away from that. Where would you have gone when you were going into your isolation?
A lot of rage, a lot of deep rage, a lot of resentment, a lot of bitterness. Because from the time people know that you are with a certain peer group, you become demarginalized. You become, there's a clear line of demarcation now.
Yeah.
They're the wheat bunch. Or long ago they call it tampi.
Yeah.
That is an old thing.
Way back.
Yes, way back when. And when the anger comes, it comes with a don't care attitude. Because remember, physically you see yourself growing up. And certain changes taking place, your voice changes and everything else. So you're still forced, right? You can't see about yourself, but because you're using the drugs and you're hanging with certain people, your attitude towards elders in the society and your loved ones, it becomes very rebellious and deviant.
Yeah.
Because you are trying to show them now, you've got to give me my space and do my thing, and they're saying that you could bring trouble to us, you are not the same person.
So as trouble starts to
internal
to develop there between your primary caregivers, your loved ones, and so on, and the group that you're hanging out with, which will be your peers on that side. That struggle comes, and of course, because the addiction might be the driving force in your life now, that group who gives you the motivation and the encouragement for the addiction, that will be the group you will be more.
They become your family.
Yeah, they'll be your.
They become your family. Strange enough, there is something called reward-seeking behavior. That when a child does something good, a parent say, "Hey, nicely done, you're doing great." But when you have gone and crossed a thin line in your adolescence to another person, that wonderful young man they knew becomes a horrible animal, because the things that come out of your mouth, your body language and your non-verbal communication towards your loved ones and those in your neighborhoods, like your elders and the respected ones, it becomes really horrible. So
and they pull away, you will pull away, and there's this gap that's created.
And when that gap is created, you leave a door open now for other substances to experiment with. Because remember, nowhere in your life you would not want to be the man. So I have had some experiences from that time. If I could go for marijuana, go.
Yes, go for it and let's see what you can go with.
I got involved in a lot of alcohol drinks because there is a perception that alcohol, because it's legally acceptable, because it's not an illegal substance, it's acceptable, but it's one of the most dangerous drugs apart from all of those, because the things that I have done, the words that have come out of my mouth, my lack of coordination that affected my body with the alcohol use, but it gave me, because it suppressed it depressed my central nervous system. I became so much more confident in terms of how I would approach young girls, despite my poverty and despite whatever people may perceive. I became like a king when I drink. I had all the nice words in my mouth. I could dance better than anybody, which was of course only induced under that drug. So there was a time after marijuana use, coupled with the alcohol, I became a much more addicted person to the both set of drugs, but preferring one more, because if you go in a social gathering, you would not be able, at least at that time, to pull out a joint to smoke.
So freely.
But drinking, because it's acceptable, it was kind of more or less a norm. So, but it did so much, because some of the most horrible experiences that I have ever had in my life was not from any other drug other than alcohol. I found myself in some places doing some kind of stuff, saying some kind of things, entering some alcoholic blackouts, because what happens that when the level of alcohol raises in your blood and goes way beyond a certain percentage, you go into what they call an alcoholic blackout. So you can rape somebody, you can kill somebody, create an accident, go home, drive back up your car, and until the police come in your face the next morning, you will have lost total memory as to what has happened. And that is one of the most dangerous things, because I've seen young girls get gang raped. I've seen good friends with certain fights that became so violent, became so aggressive, not under weed, strange enough, but under alcohol, or a combination of both, because when one wants to sedate and one wants to depress and hype up, there is a battle within your own membranes to be able to find some kind of balance. And this is what opened the doors for even further stuff.
Good, and I want to on that point, because we have so much to talk about, and we are so much things happening that we cannot even begin to get deeper into what your experiences were and so on. I want you to now see if you can, and we have limited time left.
Yes.
But I want you to now go into, you moved from cigarette smoking, you identified weed, you identified alcohol. We are familiar with the drugs cocaine that is part of the society now. Was that part of your experience as well? And briefly seeing how you moved to cocaine and how that affected you directly.
Well, I think cocaine became the real catalyst or catastrophic element in my life. Having the wanting to be the big man, wanting to be the person acceptable by my peers, that even when that drug was offered in cigarettes first, it was in the powdered form and they put it in cigarettes and it took a puff, there was just a heightened feeling of sensitivity, and that heightened sensitivity that you hear it better, you see it better, you know, your reflexes get better because it's a central nervous system stimulant.
So, you're saying, how were you introduced to this cocaine?
It was peers again, peers.
Did they come one day and say, well, you know?
No, it was another social event and they said, you want to try something new? And you already not wanting to have anything like a boys are right, like good.
Yeah, you don't want to be
wanted, yes. Because if you look back at the genesis from where it started, you want the acceptance.
Yeah, that's a group, yeah.
Acceptance.
Yeah.
So you try it, but sometimes, and this is where it becomes dangerous, because when you try something new, you never know how the effect is going to have on you. But what you expect, your expectation of the outcome, is that because you feel physically fit and everything, that you could be able to withstand it.
So you didn't think twice when they offered you this job? How did they offer you? Offer you through a cigarette or through?
It was, first of all, it was in the powdered form with a straw to snort. Right, do some lines and snort it, right in the powdered form. The real danger about that drug came a couple years after, as I would kind of I would kind of run forward a little bit because of time, is when they isolated the main alkaloid in cocaine from the powdered form of using, and they brought the purest form into the crack cocaine, which is the rock.
Yeah.
It was developed in Trinidad here, right in our part of Canarima. Trinidad is a famous place for some stuff and Jesus. And that is when the real terror and the real horror of my life began. When I was introduced into the rock form, where you would use this drug now, and we really can do another part because there is a certain language and a type of paraphernalia use, and you will hear the language used if people are not sure of what they're listening to in a conversation with the children. They will not be able to identify. There's a whole language that goes
attached to the drug use?
To all drugs. To all drugs. But cocaine in the crack form became the most dangerous thing in my life, because when you put this drug and you inhale, I'm not going to go through the process right now, but when you actually smoke this drug, it takes about 8 seconds. It is so dangerous for that to pass through almost a mile of your gut and goes through your bloodstream to hit here at 8 seconds up in your head. The only sensation of being high you will feel is from the count of 1 to 15. And after that, the paranoias and all the symptoms of fear, anxiety, your pulse begin to race, your heart rate increase, your blood pressure goes up, but the paranoia is the madness. Because when I became so addicted to crack cocaine, what normally a marijuana joint, let's say you would smoke a marijuana joint, it can last you 2-3 hours before you feel for the next one, which has you develop what we call tolerance levels.
Yes, that's terrible.
So normally, if you would use one drug to take you on this part of the curve to meet you here, before you come down, you need about a couple months or a couple years down, you need about 7 to take you from this point to this point. But what happens on the graph now? You drop it faster. So you need more and more to keep you always at the up. Because when you go down there, the depression steps in, and the anxiety steps in, and the anger, the rage, and the intolerance step in, and the personality begins to change. So you have a Dr. Jekyll, Mr. Hyde. Dr. Jekyll, Mr. Hyde. But because of time, as I continued to use the drug cocaine, I became so much more desperate. I became further isolated away from people. Because now in Trinidad culture, they call it Spranger, Piper. Yes, and then now that they tend to classify different people with different levels of drug use. Well, the alcohol man will go home, he'll cuss his wife, he will rape his daughter, he will crash and kill 10 people, they will not look at him the same way as a piper.
Certainly, yeah. That's societal,
yes.
Stereotyping and so on. But that's society. How did that addiction to cocaine then personally affect you in regard to how you, what it did to your life before to bring you to the lowest form in terms of different behavioral choices that you have made?
I isolated further and further. I alienated myself further and further. And then it began to do something horrible, because with all the other drugs, you are able to maintain a certain level of personal hygiene and a personal appearance. But under the use of cocaine, which I became fully addicted after a couple of years of experimentation into dependency and addiction, that I didn't care how I looked, the rapid weight loss, the unkempt way, because not even wanting to bathe properly for a while, because there is so much attached that when you take a smoke of cocaine, if while you're under a shower, you're telling yourself somebody creeping and waiting for you, so as you come out the shower, they wait a piece of wood or some kind of thing, because paranoia increase and it gets worse. It gets worse.
So let me ask you, what age, because you were saying that you are going up from, you moved from the marijuana, into what age did the cocaine come to be part of your experience?
In my early 20s.
Early 20s?
Yes.
Okay. And so you were saying while you were using the marijuana, you still were involved in certain exercises, certain sporting activity, and certain behavior that were healthy. When the cocaine stepped into your experience, were you still involved in all these sporting activities and weightlifting and the martial arts and so on?
No, it was almost impossible, because what happens, the only thing that becomes your focal or primary focus in life is to get up in the morning, survive, they don't know how you survive, but to get into that day, maybe to get something to eat or drink, and then to start to look for that drug. It said that drug addicts are people who used to live and then live to use. There are people that are in a grip of a continuing progressive illness whose ends are always the same: jails, institutions, and that.
So the use of this cocaine, for folks who probably have no idea what we're talking about, those who are in it, you would get up in the morning and look for a fix.
Not right away. Most times you get up in the morning, as everything else, remember, because it suppresses the appetite. It suppresses the appetite, right? It suppresses that. In the morning, if you go through a night and you sleep, well, I don't know about people, but normally right now, I can't go to sleep hungry, But in that drug, let me tell you, sometimes you go for days, you would run for days without sleep. Without sleep, because this is what the drugs are. And in that process now, all the glycogen buildup is to have to feed your muscles or to sustain you. All those are depleted, All your normal functioning under that drug goes, it creates so much of stresses and pressures on all your internal organs. That is a scary thing.
So then, where does if all those negative things are happening physically in your body and so on, where does the excitement or the motivation come to keep using the drug if those are the negative effects? Where's the motivation coming from?
With all the factors that I told you about from growing up, emotionally, remember, you're processing, you're becoming dependent, you're learning to survive and adapt to the different phases in your life and through the different uses of drugs. With cocaine, it's a different story, It takes away everything. It takes away your ability to dream. It takes away your ability to communicate effectively. It takes away almost everything from you. So I'm saying that it's one of the greatest form of bondage. Now, they say that addiction it interferes with you physically, mentally, and spiritually, and socially, right? But spiritually is where it creates the most dangerous havoc in your life. There is only the sensation of crying out to God if you are in a place of real depression or real physical or social trouble. But other than that, your whole world becomes surrounded upon that drug. That was my experience. I had experiences with other drugs. I'll just touch 1 minute. There was one time I used something called LSD in form of a butter, and the person said, put it up on your tongue and just walk. Don't swallow it. Just put it, close your mouth and walk. And I walked and I said, but me, I feel nothing. The head was so out of this world. I didn't feel anything. So I went and I had some marijuana, used with it. And then, strange enough, I went into a cinema to see a horror movie. And, in the movie Dracula, rest a bite on a woman, and she said a scream and police kicked on the door. Dracula bust through a window, turned it that door, and started running on a wall, and I started screaming on the place. Well, you know, they will snatch me from the cinema and try to drag me out, and holding on to a poster I want to come out because the effect of that LSD was so horrible that even when they get me out of the cinema, I'm afraid to cross the road now. The man said, "But go from here before we soak you up with some good body language, music, lyrics." I walked down where I was staying at the time, and I was walking down. It was close to a cemetery. All the walls begin to disintegrate and wobble, and everything turned fluorescent green. And a man just watch over the wall and say, "Family, good night." I say, "Family, may I know you?" And I started to run and scream. And that lasted for 3 days, a real piece of insanity. So that's
LSD you're speaking.
LSD. So from that experience, that was it for me, first, last, and never. So I said, let me stick with what could keep me distracted away from my pain and from other stuff, which was the cocaine at the time, and whenever I get marijuana and get the alcohol. But I wanted to say one thing. When you become addicted to cocaine, it's a marriage that there's no adultery in that, in the sense that when you get addicted to that, it takes care of all the other addictions.
Cocaine?
Yes. When you become D-spranger or D-piper, it takes care of all the other addictions.
Meaning what? You are not interested in marijuana?
If you get it, you would use it. Because like, if you're strange, if you smoke marijuana, and it will slow you down. And if you're on a beat to go and get a piece of money to buy drugs, cocaine, and you smoke a piece of marijuana, it will slow you down and create so much of fear in you that you would not want to go to look for the cocaine drug, because maybe the sedative effect would work on you and temporarily. Yeah. So there's a lot of stuff to work with,
Yes. I want to, and look, before we wrap up tonight, because our time is already upon us, and we would have, like we said before the program started, we really cannot share in detail the amount of stuff that we know that you would have wanted to share. But I want to end on a close of our session tonight on a very positive note that would leave some hope and some sense of awareness in probably some folks who are listening to us who has children on drugs, who are probably using drugs right now, or probably has family on drugs, and they may be going through or listening to or are probably experiencing the same sort of experiences that you are speaking about tonight. But tonight we want to offer them some hope, because you would have had in your life literal experiences of where drugs took you from, but you also have very real, practical, real experiences of how you could come out of this marriage, this addiction, like you call it. I wanted to offer to all who are listening tonight how you came out and how they can come out of possible addiction or possible life that they maybe think is hopeless at this time.
Amen. I want to say that there is always hope. And I believe once a person has life, they have hope. And we should never give up on anyone, despite what you may see physically unraveling before you. Because after living on the streets for around 17 years and being abused and abusing myself with the drugs and everything else, I was at the top of the savannah one day, and I happened to walk down Donald Street, and there was an old grey-haired man standing up in a balcony, and he said, "Hey, you don't pipe where you smoke cocaine?" I said, "Well, you're not playing real fast with me or what?" He said, "Want a cup of tea, Sonny? Sonny, you want to sit down for a few minutes and talk to this old man?" And I want to tell you, that old man became a friend and godfather to Trinidad and Tobago. His name was George Maximin Tandy. He was a recovering alcoholic who was renting that place. And that place became known as one of the greatest rehabs in Trinidad right now, called Rebirth House. And from that day in 1986, I had just come out of prison. I had experienced some time because of the wrongs I had done, Apart from living on the streets, I've been to prison. I went to St. Anne's a few times in my house, because when drugs get so bad, it begins to interfere with your personality, and I went into that place and I had a few relapses, even while seeking the help and attention, because I didn't understand it was new to me. But I became attached and became a lifelong member of that place. 34 years now. I'm a senior therapist with Rebirth House. I have worked with Families in Action, a Marvel, another counseling company, but I have been like, and I am a friend to so many thousands of people who I know been there and done that. And the greatest word we could ever use is not sympathy. Don't give a man sympathy if you don't have a phone number or an address to give him. So I'm going to give you 6230952, Rebuild House, 6278894, Families in Action, 6280337, and just pick up a phone and call, or parents, you can start to look through what are some, if you suspect a child is on drugs, go Google and you find out what is the nature of the drug and what are some of the symptoms attached, so you can have a better idea as to what's maybe taking place, and then call.
Okay, great. So those are some of the avenues. From your experience though, particularly, can you share with us briefly, because we have almost about a few minutes, how did you move from being addicted totally to a pastor or to a person who no longer is dependent on this drug? Tell us at that particular point, what happened that caused that?
All right, briefly I will just share that there's a program called Alcoholics Anonymous, which offers 12 spiritual steps. Not religious, 12 spiritual steps. And the final step is one that haven't had a spiritual awakening. As a result of these steps, we try to carry this message to other addicts and alcoholics and to practice these principles in all our affairs. So when Rebuild House gave me an insight that the only solution, apart from whatever you may do, is to find God, the God of your understanding. And right here in Beach, there were some people, wonderful people, who supported me spiritually at the time, but they didn't have any insight as to clinically what was taking place. So they didn't know how to direct. Their love and their comfort was all that I had, but it wasn't enough to help me. So I'm saying to you that there are certain things that you need to do first, is to get that person detoxified in a place, get them in a place where there are other people like themselves who are struggling the same things but are holding on. And then eventually what happens is that following the guidelines, God enters, and with the support of family members who may still or may not be there, God does the rest. So I'm saying there has to be a desire to want to do something better. And after living all the years of horror and the life that I have lived of need and detachment from people, I just wanted to make a difference with my life, and God worked through my life through different people and different agencies, different communities, and I just said, I just wanted to give everything up to God and have it use me, so that maybe I can continue to be there for somebody who may need, what I can.
Well, certainly you are there for people, and you are there even tonight for many people you have shared with us and with many who will be listening all over the world. How your story started, how it unfolded, how it graduated, and how it is at the present. And we want to commend you. We want to say to all who are listening that your story can be used as a motivation. Your story can be used as an example of hope in the face of whatever hopeless case may be existing in the home. Because drugs, like you would have said to us several times tonight, is not really something that is manageable or something that you can just sit down and decide, let me get up today and stop using this, or let me get up tomorrow, and it's not like that for many. So the numbers you have given us, the experience you have shared with us, we want to end on a note of hope and a note of encouragement to all who are listening. That
numbers.
Yeah, you can repeat the numbers again.
The numbers are 623-0952, that is Rebuild House's number, or 627-8894, or Families in Action is 628-0337.
Great, so you have those numbers right at the top of your head, remember that. And so, just in case you would have missed it again, you can look at the feed again and get the numbers again, right? Too. But those are some very important numbers that folks who are listening to us can connect with. And like you said, they are supporting agencies along with the families of these persons who can also connect with some kind of remedy or some kind of solution for folks who are attached to drugs.
Well, what I can say is that the first two numbers that I gave you, they are I call them the governing body of help for addicts who really want help, because there is no sort of red tape to get to them. You call the numbers, you express a desire to really want help, they open their doors one time to
That's
you.
good.
Now other people, I'm not saying anything negative, but sometimes when a man cries out for help, you don't know the breaking point is whether he wants to commit suicide or he can't go no more.
Yeah.
But we both have those two numbers, 623-0952 or 627-8894. You get immediate counseling and the possibility of an open door for you for an in-house rehabilitation program almost instantly.
That's great. That's great. That is what folks may need at a particular time of crisis in their life right there. So those numbers are good. And not only that, you would have also connected to the fact that you would have connected with good folks around you who helped you or channeled their energies into the right direction, even though you were at that stage of your life. So we want to endorse that. We want to encourage folks who probably are listening to us, or families who are listening to us, to follow these directions that you have shared.
May I just say one?
Yeah.
Keep praying and covering your children. Keep praying and covering your loved ones. Even somebody who might be in the community who have slipped off and gone off that edge, keep covering them. Prayer works. We serve a prayer answering God.
Definitely.
Because years ago when I was struggling, before this, I know this as World Change, this assemblies.
Yeah.
It was St. Paul's Baptist Church.
Yes.
And my first experience, deep experience of hope, was one day I could really make it. And even though I didn't stay connected, because life took me through some real
different experiences.
But here I'm back today, after nearly 25 or 30 years, back under a different governing body, but same people, the Aberdeens. I can't say more, but just God bless them in a mighty way.
Thank you so very much for those commendations. And for in your community as well, there will be churches that you can go to and find the same kind of support. Yeah, that's always.
God is the answer.
Yeah. So thanks again, folks, for viewing us. And we want to commend you and thank you for spending the time with us tonight. Take note of those numbers, and we want to close up tonight by saying have a great night. Connect with us, share the view, share the experience that you would have had tonight with us. And we'd want to see you again at another time when we have our Wednesday night program. Thanks for viewing.